to give people the extra incentive to get vaccinated and hopefully prevent what's going on in some of the southern hospitals.
I think we're approaching a public health crisis with all of this. We've seen what's happened in the southern states. We've seen how rising numbers of the Delta variant for the coronavirus has increased hospitalizations, increased strain on the hospitals. And then also we've seen those parallels starting in Nebraska. Just 5 weeks ago, we had less than a handful of patients at Bryan Health, and now we exceed over 50. We've opened up 4 COVID units to take care of patients. We have patients waiting in our emergency room this morning, so for an inpatient bed. So the timing of vaccination, as everyone has said, we've been awaiting to find out that final approval, but we've seen hundreds of millions of doses of vaccine being administered. It's highly safe, it's very effective, and it's readily available. And we feel it's time, and this group has been united in saying it's time that we move forward in requiring vaccinations. We know it's the right thing to do. We know it's safe for our staff, our providers. We know it's safe for the community. We really need to push through this so we can really decrease this pandemic. The treatment of this virus is really a defense. It's prevention. We don't have great treatment options for this virus. We do have great prevention that's been developed, and we need to utilize that in the full extent. It's our best resource.
Are you just worried? If I could just add one quick thing to that. Dr. Trapp and everybody's talked about the impact on our patients. Certainly just one thing to stress also, we are seeing in other states, employees are increasingly calling in sick, and we're all seeing that ourselves. We've had a marked increase. We have to have our employees at work. They want to be at work taking care of these patients. So another really important reason. And I just want to say one other thing about this. 2 measures, I think we would all agree that have had the most dramatic impact on public health have been clean water and vaccination. And we all have vaccines in us right now that have had a dramatic impact on the health of our communities. And if you do a comparison of this with like influenza, which most of us mandate, it just another kind of justification for this. Influenza is far less severe than COVID. COVID is far more prevalent right now. The vaccine is safer or as safe and is more effective than the influenza vaccine. So it makes such sense right now. If we're going to require the influenza vaccine, we would also require the COVID vaccine. I think waiting has been the appropriate thing to do just to make sure for all of us that the vaccine is safe and effective. It's now proven. The FDA delays are fine details. Their paperwork, their shelf lives, storage requirements. The science is clear. Nobody's going to question the science of how effective and how safe these vaccines are.
Are you guys worried about staffing shortages moving forward? I know we're already seeing that, but are you worried that this decision will, cause people to quit?
So this is Harris Franklin, Nebraska Medicine. Absolutely. We've considered that in the process of our decisions. We recognize that there's a lot of vaccine hesitancy with some of the staff. We hope, however, that through the educational opportunities and empathy that we believe that we've employed in listening and giving people space to voice their concerns, and the efforts that we will make to help counsel, that we can convert a lot of this vaccine hesitancy to vaccine confidence. If you look at Houston Methodist, who was one of the first institutions that went through this with a vaccine mandate, their turnover was less than 0.5%. And so, yes, there's some risk, and we've all acknowledged that risk. We recognize that risk. We've discussed that in detail amongst our teams, but it's a risk that we are willing to take for all the reasons that have been stated by my colleagues on the panel here.
In addition, there will be valid exemptions. We all know that for religious and medical, there are valid exemptions. There was the question that was asked about are we full or out of beds requires some clarification, I guess. We have 145 beds at Children's Hospital and Medical Center. This morning I had 132 patients in those 145 beds. So yes, I have additional beds. Do I have all the staff that can occupy the rest of those other 13 beds, we can get creative. We get very creative, and we do that on a daily basis. We can fluctuate 20 patients in a day, up or down. And if you have 2 days of just down, then you're 40 patients lower than you were 2 days ago. We can also go up those same 40 patients in 2 days. So we staff accordingly, and that's just what we do every day of the year. We're ready for a surge. And so we're a little concerned, yes, if some of the people want to leave our organization because of this new policy, and we hope that we can turn them into vaccination confident people, as Dr. Frankel stated.
We already require a number of vaccines. We require the measles, mumps, rubella, influenza vaccine, hepatitis vaccines. So again, I think we're hopeful through education processes that we can motivate our patients and motivate our staff and educate our staff to receive the vaccine. Again, we want to emphasize very safe vaccine, very effective vaccine, and we want to protect our staff. We want to protect their spouses. We want to protect their children, grandchildren. It's an important thing to do.
We announced CHI Health, real quick, I'm sorry, Bill. CHI Health announced last week that we had this number to call for folks to come in and to call, get any questions answered by a provider. I just wanted to say, we've had over 600 calls to that. People want to know, they want information. They've been very positive sort of calls. We've given over 500 vaccines in our clinics over this last week. Not that all of them were related to these calls, but we do think as people get more information, as they now better understand the safety, just like Dr. Frankel said, I think that the turnover, the number of employees who aren't going to get the vaccine and leave the organization is going to be incredibly small. People love what they do. They love their work. They love taking care of patients. And I think they're going to want to continue to take care of patients.
And I would add, too, that just since this announcement was made this morning, I've had multiple text messages thanking us for making this decision for the care of our patients.
It's overall my sense that there will not be employees lost. I think, I have the confidence in them that they really are committed to our patients. They're committed to each other. And as I mentioned, there really is, as Dr. Bradford just mentioned, that there's a sense of relief that this is going to happen.
I just wanted to do a quick fact check on the institutions that already have a flu vaccine mandate. All I need, I guess, is just a thumbs up on who already has that in place. So 4 out of 5, 4 out of 6.
No, I'm sorry, I've lost my video. MSH does. Midwest Surgical Hospital does.
Great, thank you.
I wanted to get your guys' opinion on a statement that was made this morning by Governor Pete Ricketts. He made it at the Federal Legislative Summit in Ashland, saying that kids are not at risk. This is a direct quote that he said. Kids are not at risk. Kids don't get COVID. What is your response to that?
Well, the facts for the southern states right now with the Delta variant, which is very different than the native variant that we had 6 months ago and even before that the children's hospitals are having a lot more children being hospitalized than we have before. That's all I can go by, is that the facts are in the southern states right now. Children are being hospitalized both in the ICU as well as on the medical surgical floors.
But here in Nebraska, I mean, specifically since we're talking about a Nebraska governor, are kids in Nebraska getting COVID? Are they being hospitalized for it?
Yes, but not nearly the rates that are in the South. We still do have Delta. In fact, the Delta variant is the most prominent variant of COVID-19 right now in our community. And so we are seeing it.
Brian, we're actively preparing for a surge of potential increased pediatric patients, just in case Children's Hospital gets filled with RSV and COVID. We need to be prepared to help assist other communities with pediatric care, and that may include